Well, hello, greetings, and welcome to our National Pediatric Grand Rounds on COVID-19. We're talking about the effects of COVID on youth, and we're trying to squash any vaccination myths and fears that anyone might have. My name is Dr. Eric Griggs. I am a member of the National and International Health and Wellness Committee of the 100 Black Men. I'm also the COVID Action and Policy Chair. I actually reside in New Orleans, community medicine director for a system of FQHCs called Access Health Louisiana, and happen to be a health educator at Fox 8 News, and been doing a little bit of everything COVID since March 13th, 2020. If it was true, I heard it. If it's false, I heard it. And I've actually lived it. So here we are. And one of the things that we can do for each other is use what we have in our family. We have an amazing panel here. We have pediatric cardiology, we have pediatric and adolescent medicine, we have urgent care medicine, we have community medicine. We have a real expert who happens to be 16 that is an advocate and in the know. He's somebody that I definitely want to be like when I grow up. So you'll get to meet him in very, very shortly. To begin, though, I'd like to, so we all family and people. I don't know who you are, but in Louisiana, everybody speak, and you got to know who you're talking to. I want to begin by introducing Dr. Kiana Allen. She's a pediatric cardiologist, and I would be bereft in my duties if I tried to introduce our esteemed panel myself, because I don't want to leave anything out. Dr. Allen, if you'll introduce yourself, and we'll go down the line.
Well, thank you so much. I'm very excited to be here talking to all of you. I'm Dr. Kiana Allen. I am a pediatric cardiologist, actually a pediatric cardiac intensive care doctor. And I'm also the medical director of the cardiac care unit at Ann and Robert H. Lurie Children's Hospital of Chicago. So that means that I take care of children who have critical cardiac disease, and I'm board certified in both pediatrics, cardiology, and critical care. I'm also from Chicago originally, or I guess not technically from Chicago, but from Oak Park, and have lived here most of my life, for those of you who are local. I'm just really happy to be here.
Now, I'm going to tell you this. I went to Notre Dame undergrad, and I met a lot of people that weren't technically from Chicago. If you're a Bulls fan, if you live close enough, if you can drive, you from Chicago, you ain't got to do all that for them people. Thank you for joining us. Next, I want to introduce our expert of experts on youth, the youth attitude and the experience in the field with COVID-19, and that would be an amazing young man, Mr. Donovan Miller, who happens to be 16. Now, Donovan, I'm going to tell you now, first of all, you got to turn your camera on. We good. We all family. Turn your camera on, bro. We good. If you leave anything out, I'm gonna hype you up myself. If we can't celebrate each other, especially our youth, then we can't celebrate anyone. Now, if we're having technical difficulties, Donovan, while you're doing that, I'll deal with an old head. And the reason I call him an old head is because he don't have no hair like me. We'll talk to another of our esteemed experts, Dr. Michael Mcgee, who I've been told to only introduce as a COVID chair of the 100 Black Men Chicago, but like I told you, I'm gonna let them speak for themselves and say, bro, if I can't celebrate you, it's okay to talk about it. It ain't bragging if you did it. I just introduce yourself, please.
Hey, what's up, brother? I see you are the king of animation, and we'll even get into that even more details later. But we do have another guest who is running a little bit late because her clinic ran over, but we'll get back and introduce her when she hops on. I'm gonna go ahead and get started, and I'll introduce myself in my presentation. And for those of you who've been out here there knowing, seeing these things that I've been doing over since COVID began, I like to do PowerPoint presentation. It's pretty quick and it's interesting, and it gives you facts, and it's not like the internet where you're getting all this extraneous information coming at you that may or may not be true. I have friends who never went to medical school or PhD who are out there trying to be experts in this thing. And so I try to kind of like give the real deal. And so I'm hoping you guys can see my screen right now. Would you guys be to see this right now? Dr. Griggs?
Yes, we can.
All right. So let's get started. So this talk is basically talking about the effects of COVID upon youth. And that's the piece that's been missing, right, guys? We've been hearing about COVID since, February of 2020. And we have not had people really have dedicated talks for the youth and the parents. And so that's what we're doing today. I'm Mike McGee. I'm actually a ER doc. And by the way, this is my new presentation for COVID. I used to have this on the left, which is the red thing, which was COVID. And now, as you can see, the Delta variant is of most concern. And so for me—
So Dr. McGee, are you saying this is a remix?
Sort of, yeah. It's a remix and a never-ending nightmare, if you want to be technical. So I am the chair for 100 Black Men of Chicago for COVID. When it first started, we gave a series of talks throughout Chicago. We had everybody on, from the chief of police to experts in the field to psychiatrists to youth and to youth organizations. My trade actually is I'm actually an ER doc. I just happen to actually be the CEO of an urgent care in downtown Southside Chicago in Hyde Park. It's called Premier Urgent Care. I'm also the chair for 100 Black Men of America's Violence Prevention Committee. And I am also involved with a lot of different organizations as well that deal with violence prevention. But right now we wanted to pivot and focus on something that's really, causing a lot of sadness in Black and brown communities. And by the way, I do have a master's in epidemiology and biostats. And so I put together all the different trends and the numbers that can affect all of us as an entity. And so we'll talk about all that briefly. And so this was me on the right before COVID. As you can see, very happy, no mask, living the life. And so what are we going to do today in this brief presentation is we're going to discuss the complications of COVID. We're going to learn about the importance of vaccinations. We're going to recognize some of the dangers of the Delta variant. And most importantly, I want all of you to understand the importance of Black and brown communities working together to overcome these fears. And so before moving on, we're going to have a nice little animation by Dr. Griggs. I'll let you take over there, Dr. Griggs. I see you in another light.
Hey ho, let's go. I'm Dr. Mark Allenderry, and I'm an infectious diseases doctor and epidemiologist.
And I'm Doc Griggs, and I'm a community health specialist. Speaking of special, today's podcast is coming live from inside the human body.
So, Doc Griggs, does that make it a podcast?
Dude, don't make me regret sharing my space-time hop trick with you. Thanks, TV sitcoms.
So, these COVID-19 vaccines are super safe and effective, and thankfully, were developed quickly in response to the global pandemic.
First, let's explain how the coronavirus makes us sick. Ooh, check out those spike proteins on the coronavirus. They help it burst through healthy cells, where it replicates inside, destroying the cells and making us sick. I really hate that dude.
The vaccine will take care of him. Vaccines stimulate your immune system to fight viruses. Some of the COVID-19 vaccines work by delivering mRNA to your cells. Think of mRNA as instructions that activate the immune system.
Let's check out a healthy cell to see how mRNA works. The COVID-19 vaccines deliver a package loaded with millions of mRNA to your cells. Then the ribosomes read the genetic code on the mRNA like a manual and produce spike proteins that mimic the COVID-19 ones. That stimulates your immune system to make antibodies. Now, off to the lymph nodes.
Here's where antibodies are created. The heroes that fight coronavirus. The spike proteins attach to the antibody, leaving an imprint of the spikes, basically setting a trap for the nasty coronavirus.
When this part of the antibody attaches to these spike proteins on the coronavirus, it immobilizes the virus and stops it from infecting our cells and making us sick.
If an actual coronavirus comes into the body, the antibodies are ready to rumble!
Paddle faster!
That's why COVID-19 vaccines are essential for teaching your immune system how to fight off the coronavirus.
And that's our show for the day. Ready to roll?
I've got this.
So let's get back to this presentation. So essentially, we all know this, right? We first started hearing about coronavirus. We thought it was just a cough, shortness of breath, and maybe a fever. But then it evolved over time. We started seeing that, hey, people were losing smell and taste. And then they were having not only loss of smell and taste, but some were having body aches, some were having sore throats, some were having headaches. And then we started seeing people that was having vomiting and diarrhea, which as an ER doc, when we first started hearing about that, we automatically ruled those patients out. There's no way they could have had coronavirus at that time because they did not have GI symptoms. And so now, as you can see, you can have any and everything, which is scary. And what about the difference between youth and adults? Where adults would get all these things that we see here. They would have fever, cough, headache, sore throat, body aches, but most important, shortness of breath. Whereas kids did not get the shortness of breath. They were not getting pneumonia. They were not getting the acute respiratory disease that would send them to the hospital. And that's part of the reasons why you didn't see a lot of kids going to the ER. Also, coronavirus is, in fact, the common cold. So a lot of our kids in elementary school and daycare had been used to all these coronaviruses. And so they had a little degree of immunity towards it. So they didn't get as sick as much as adults did. And we also found out that 50% of people would have symptoms, but could still spread it. But of course, most people would do well. About 80% would recover and have no problems. But then 13% would have pneumonia and shortness of breath. And then about a small 5% would go on to acute respiratory failure and shock and death. And so this is a busy chart here. And basically, I just want you to see that most people who were ill were mild and went home. And in that in between stage, we had people who had fevers and shortness of breath, but may have also had pneumonia. And sometimes they would be kept in the hospital, especially if they had other medical problems. And then, of course, that 5% would most likely get intubated. And that's what we were doing initially. And so this is just shows you a quick chest. On the right is a normal chest where you see the heart, you see the ribs, and then on the left, you see all this white stuff. Well, that's just showing you disease in the lung as a manifestation of coronavirus. And this is a CAT scan. On your left, you see those white spots. That's kind of like the scar tissue you see on a CAT scan from coronavirus. And on the right is a more extensive disease in someone who has severe coronavirus. And look at this right here. This is from the lung of a 20-year-old female who actually had to have a lung transplant after getting severe COVID. And as you see those little blood vessels on there, and we've come to find out that coronavirus actually affect a lot of the blood vessels, which is why you see people having strokes and heart attacks and clots in their legs and lungs. And at one point, we would intubate the minute they got there, where we learned, hey, it's better to not intubate. So we would try to not intubate someone because a lot of times they would not be able to come off the ventilator. And so over time, we got better. And by the way, this was me doing that pivotal moment when coronavirus was everywhere. He was wearing all types of gear. And as you can see, looking in this first column here, when we first heard about coronavirus, the risk factor for people under age 50, was very low. But then as it evolved, we saw that, hey, between 50 and 59, you can have 12%. Even between 30 and 49, 12% will still die. And in fact, it wasn't 0.2% for people under 30, but it was actually 0.5%. We found out over time that it can affect you. And now, as I said before, world data is important because as you can see, when this first started, USA, and even now, we're the #1 country in terms of the amount of people that have died. We've had over 625 people die. And this is data from today. And not only that, India is #2 in terms of the number of people that who've gotten the virus, but they've had 412,000 people die. And Brazil is second to the United States with 537 people that have died from coronavirus. And it's still happening. And so we all know about the health disparities, which is bad things that happen to one particular group, particularly Black people and Latin people and Hispanic people. And so you all know this. 13% of the population are us, Blacks. But yet we accounted for over 50% of all COVID deaths, which is a health disparity. Again, Blacks were 2.8 times more likely to die than whites. In fact, looking at this as well, Blacks and Hispanics, 2.8 more times likely to die from coronavirus than white people. And so we knew why they were dying, right? We knew that mostly older people were affected, but then people of any age with underlying medical conditions could die. And so what does that mean? Well, we know that Black people have a lot of hypertension, diabetes, heart disease, obesity, chronic disease like asthma and COPD, HIV. But guess what? Youth do too. So look at this. Kids can have congenital heart disease, about 1%, which accounts for about 40,000 births per year. Kids can have hypertension. According to the Academy of Pediatrics, the CDC study showed that 1 in 25 kids aged 12 to 19 can have hypertension or high blood pressure. Diabetes, type 1. We all know that kids under 14 can have type 1 diabetes. And in fact, kids 12 to 18, 1 out of 5, which is about 18%, can have type 1 diabetes. And guess what? As we went through this, we saw that, in terms of people who had high obesity, they had a greater chance of dying. They had a greater chance of having hospitalization, ICU, and deaths. And guess what? 21% of our youth are obese with a high BMI, which can lead to more deaths. And then lung disease. Kids have asthma. In fact, 6.1 million youth under 18 have asthma, which is a major risk factor. And then kids get cancer. You look at the age 15 and 19 years old, there are about 5,000 to 6,000 kids a year getting cancer, and which is about 23.5%. And so in terms of HIV, 1 out of 4 kids, 13 to 24, have HIV. 4 out of 5 are males. And in terms of new infections, African Americans make up 60% of new infections for HIV, whereas white and Hispanic only 20%. So those are major risk factors. And then we started hearing kids can have called MIS, which is multi-system inflammatory syndrome, which is basically a kid getting septic shock, where now they can have diseases in the brain, they can have inflammation throughout their body, they can have cardiac dysfunction, which can lead to heart attacks, and inflammation, which is myocarditis, which you've been hearing a lot about. They can have DVTs as well, and then they can get acute kidney injury. And so we found out this past January and February at the peak that a lot of kids can actually get COVID. And they saw a 20% increase in infections. They saw that kids were getting it more than before ever in the past. In fact, the American Academy of Pediatrics saw that initially kids were only getting COVID 3% of the time, but then now it was 22%. So now you had more kids being adversely affected by COVID. And so now, what about long-term complications? Well, we all know that the long haulers, we've heard about that. Long haulers are basically affected by receptors in your body that can be in your lungs, your heart, your GI system, your brain. And so it causes all these different symptoms: cough, fatigue, body aches, chest pain, palpitations, shortness of breath, loss of taste and smell, and nausea, vomiting, diarrhea. But then it also can cause insomnia and brain fog. And then we found that 1 out of 4 people who had COVID can become long haulers. In fact, you didn't have to have any symptoms. You could have been asymptomatic without any problems at all. And then 10 days to 3 months later, you're now having all these strange symptoms that you didn't know you even had. And in fact, youth and teens can be affected. And also cardiac disease, all these things from arrhythmias, which is irregular heartbeats, to congestive heart failure, to inflammation of the heart, can also be affected by COVID. And then of course, the mental illness is all throughout the country. About 1 in 5 people can develop anxiety, depression, and then psychosis. And this is well documented. In fact, a lot of hospitals are opening up long haul COVID units to basically deal with kids that have lingering COVID. And so it's affecting kids and youth. And then we all know at one point, COVID was the leading cause of death. But then something happened. What really happened? Did the treatment make a difference? Did people start taking all their vitamin D and eating healthy, and that's what caused the shift in people dying and getting sick? And at one point we had 3,500 Americans dying per day from COVID. And then now we have about fewer than 150 to 300 Americans dying. And so for all you smart people out there, the science is clear. The cases, the hospitalizations, and the deaths declined since the vaccines started, since they were being given, since people were actually taking it. And so they proved that they were effective during this period of time and saved a lot of lives. And guess what? We started having variants. The more people are out there, interacting, not wearing masks, not social distancing, it results in mutations in this virus. And so now we had all these variants, and then we found out that the vaccines help against the variants. In fact, this is just a busy study table showing you that all the different vaccines were pretty much very effective in preventing deaths from most of these bad vaccines from the UK, from Africa, from Brazil. And so, in fact, sometimes the vaccine even helped with people with long haulers disease, so that all these symptoms you may have been having after being, cured from COVID and feeling better, you now can have these long standing conditions that if you took your vaccine, it would help. And just to further prove it, this is all the new cases from last year, April 2020, to where we are now, May 24th. You can see between December and February, we had the greatest peak. And around December, end of December is when the vaccines first started. And so you can see this rapid decline, and there's no other way we can attribute that to other than the vaccine. But then now here we are in March, and we start seeing something else, that a lot of kids were now getting the COVID-19, and that kids were now, who were unvaccinated, were having severe diseases. And so all the pediatric organizations, and this is fact, started advocating for youth 12 to 18 to get vaccinated. The American Academy of Pediatrics and all their counterparts, the American Academy of Family Practice, ER docs, all the organizations felt that it's important for them to get vaccinated. The CDC, the World Health Organization, all advocated for it. And it's simple, right? Kids now are getting more infected, 22%, as opposed to 3%. They were now affecting older adults in the house and other kids who have risk factors. There are kids who have risk factors, who have hypertension, diabetes, obesity, like I just said. Kids was getting this MIS, which is causing severe death in kids. And then the long-term effects that affect the brain, the heart, the lung, et cetera, et cetera. And most important, low risk. Even though kids have low risk, they still die. And I don't know about you, but to have a child die without even having a chance to live a full life is disheartening. This was a superstar 15-year-old young lady who died in March, 2 days after testing positive for COVID. And so as a result of that, the CDC, the FDA expanded vaccine authorization to 12 to 15-year-old. And so we've gotten it. And so why are we hesitating still? We got all these internet experts that's telling you why or why not you shouldn't get this thing done. Most of them are saying that you should not. They're telling you a bunch of things that are not necessarily true, that have not been proven. Some people may have a fear of adverse effects. You hear about inflammation of the heart or myocarditis. It happens with COVID. Matter of fact, you have more severe episodes of inflammation from COVID. And our pediatric cardiologist expert will talk about that a little bit later. We all concerned about syphilis, something that started, back in the 60s because of the unethical thing that happened back then. Well, that's been changed. There's a lot more regulation going on. These things are not happening today. And we all think we've been told the government is trying to control us. They're injecting trackers in our body to control our DNA. It's not even possible. And then we have anti-vaxxers who never even got immunization, who we're never going to be able to change their mind. But most importantly, parents got to recognize that your kid could be next. And we're not trying to put fear in your heart. We just want to give you an educated decision for you to make the proper decision. And then the long-term effects. And now I was concerned about that. My 12-year-old twin daughters got their vaccinations and they completed them. And I'm concerned about the long-term effects. Heck, I'm concerned about the long-term effects upon me. But I'm also concerned about the short-term effects and the long-term effects of COVID, which are steadily evolving. We don't know. And so now looking at this here, 12 to 15-year-olds, they're only 28% have gotten their vaccinations, according to the United States data from the CDC. And so what's the Delta variant? And I'm finishing up. I just told you it mutates if you're not doing the proper thing. It was first identified in October of 2020. We all saw those pictures in India where they were burying people in graves, just stacking bodies up. And that's the main variant that was killing people in India. And it's 3 times more infectious as opposed to the original coronavirus. As a matter of fact, the CDC is saying that half of new cases in the US are now traced to the Delta variant. But guess what? The CDC also states that over 99% of the people who died were people who were unvaccinated. So that's science. It's telling you got to do it. In fact, now there's a different, divide in our country between people who are vaccinated and unvaccinated. And a lot of the unvaccinated people are basically spreading a lot of the fears, and a lot of it's coming from the wrong sources. But if you look at the science, all these cases are now driven by Delta variant. These are all the cities. This is the past 2 weeks of what has happened in the past 2 weeks. COVID cases are up. And now look at this. There are a bunch of different variants out there, the Alpha, the Gamma, the Delta. And so if you look, Alpha in green was the main virus in May 22nd. Here we are almost, a month later, and look at in red, the Delta is taking over. So that's a travesty. And by the way, Mississippi is one of the lowest states that have the lowest number of people vaccinated. And kids are in the ICU and on ventilators and not doing well. And so we all got to do our part. We all got to jump in and do what we need to do. And so what we're doing here in Chicago, and why we even have this talk today, is we're getting together with everybody from Chicago Department of Health, Blue Cross Blue Shield, the Black Nurses Association, Cook County Physicians Association, Urban League, 100 Black Men of Chicago. But also we just partnered on a national level with Morehouse, 100 Black Men of America, and the National COVID Resiliency Network, which are a whole bunch of different Black and brown universities and hospitals all over the country that's trying to instill credibility in getting a vaccine. And so we're doing good things. We're trying to have a big event July 24th. We're having Dr. Griggs fly in all the way from New Orleans to be the spokesperson for 100 Black Men. We're doing different flyers to attract our youth. We're having kids coming in and do a talent showcase. We're going to have a youth band performing. We're just trying to get all this on camera so that others can see that, hey, it's not as bad as we think it is. As a matter of fact, this is the website and the link to go to, which is the network of a COVID resiliency network for you to go and to see what it's all about. It also has a locator that can tell you where to go to get vaccinated, to get help if you have COVID, and to get tested. So I encourage all you guys to take this link down and use it. It's housed at Morehouse. And for the event we're doing on the 24th, we wanted to show best practices for how kids can get vaccinated. And we want to have, this to be seen through live stream and on the 100 Black Men website, because we want everybody to see, hey, I know you have fears, but school is coming. You want your kids back in school. It's not healthy to have them out of school. We got a whole bunch of mental health issues that's been happening since kids have been locked in. We want to get them back, but safely, and we want to have them to do well. And so we want to highlight this and show this to everybody. And so without further ado, I do want to show another quick animation by Dr. Griggs, and then we'll open it up for Dr. Griggs and our specialists. We're here to answer all your questions. So we'll end with this. Thank you so much.
Hey ho, let's go. I'm Dr. Mark Allen Derry, and I'm an infectious diseases doctor and epidemiologist.
And I'm Doc Griggs, and I'm a community health specialist. On this episode of COVID Noise Filter, we're talking about COVID vaccines and variants.
So you meant to snap us into some three little pigs' tale?
Watch and learn. Imagine your body is like a house, and COVID-19 is trying to break in. Antibodies created from vaccines are like your security system, recognizing the intruder and destroying it. But viruses are smart, and they mutate, putting on new disguises to bypass your security system.
Even if you're vaccinated, COVID-19 variants will emerge and transmit, and your antibodies will have trouble recognizing them.
That's why we need a booster shot.
mRNA vaccines help your immune system recognize COVID-19. When the virus mutates, the booster shot provides updated antibodies specifically designed to fight these new variants.
Basically, we need to update our security system to keep out these new nasty neighbors.
That's a wrap on today's episode. Ready to roll?
Dude, please, no, please don't.
Real nice. Real nice.
A hand clap to you, Dr. McGee. Thank you for that presentation. I only wish it was that easy and I could pop my way around all over and get everyone vaccinated. Folks, I hope you enjoyed that presentation. It's very rare, people don't realize, we take for granted because there's like 1 degree of separation. I just realized who Dr. Whimberly is. I met her years ago through Dr. Lisa Walker. We all know each other, and we assume because we know each other that there are not this few of us in the field of medicine. There's less. It's about 2.9% of all doctors in medicine are African American, and we need to take advantage. Thank you, Dr. McGee, for organizing this in the 100 and NCRN, Morehouse, everyone for putting this together so more of us can see us, because y'all know we believe us. The first thing they say is, well, look, I'm going to do it after you do it. What you say? I don't know him. I know you. Now, people talking about, literally, I don't know about y'all, but I literally had to stop people from putting blow dries up their nose trying to prevent COVID just because they heard it at the barbershop or walking down the street from their partner who had a friend that worked in a lab, who had a cousin that had on a hazmat suit and has said that blow drying, we've heard it all, right? And that's what got us in trouble at the very beginning.
Steam baths. They were putting their head in hot water and the steam.
The hot water and the steam. Like, y'all know y'all ain't never tried to take that many baths and showers in y'all life and know it don't work. But that mis and disinformation and the fact that we have effectively gotten together as leaders, and Donovan, I hadn't forgotten you, and Dr. Whimberly, I haven't forgotten you either. I'm getting back to you, but our mantra at the 100, our platform is what they see is what they'll be. And you think about that in terms of mentoring in kids, but it's not just that. I can't tell you, and all of us on this panel, Donovan, I'm including you, have all been told there's nothing better than a compliment from a grandmother or a great-grandmother or great-grandfather. Baby, I'm so proud of you. Thank you for what you're doing. I understand. That's the reason that we put the animations together, because a lot of us, as quote-unquote smart as we like to think we are, even though SMART is an acronym for Simple Mastery of Accepted and Repeated Theory. The reason we know 2 + 2 is 4 is because somebody taught us that. Cognition, intellect, and my grandmother used to call mother wit ain't something they teach in school. So the fact that we're here and we're doing this, we realize that it's important for us to talk to us because it's us that's being most affected. I want to get to our resident, our true expert. And if I could be 16 again, I would not. But since he's 16 and he's an expert, and we're talking about adolescence and youth, Donovan Miller. And like I said, you heard me. I'm going to help you. If you don't introduce yourself enough, I'm going to celebrate you now. Tell us a little bit about yourself, please. Mute, sir.
Hello, can you hear me now?
Hello, there it is.
Hi. Like you said, my name is Donovan Miller. I'm 16 years old. I'm a rising junior at the University of Chicago Laboratory Schools. I'm also a 100 Black Men of Chicago South Suburban Chapter mentee. And I just really want to spread the message that people my age should get the vaccine. I think that it's important. I think that it's beneficial. And I definitely think that it'll help return us back to normal life. I spent most of this year in school, most of my sophomore year, and part of my freshman year doing virtual school. So I definitely recognize the importance of moving back to normal school. And I think that the vaccine will help us do that.
So now, like I said, I'm gonna help you out, Donovan. Can you please, we celebrate. We just had Miss Avant-Garde show us that we can spell, dribble, chew bubble gum, break records, and do all that other things. I want you to tell us the fun fact you told us. Where are you right now, and what are you doing at 16? Look at that smile. There he is.
Right now, I'm at Brown University. I'm in a dorm room right now. I'm taking a entrepreneurship course, a 3-week course for the summer.
Now, back when we grew up, back when we had hair, we would do the cool thing and the snaps. Now, can we just give them a round of applause? Thank you. Thank you for stepping up and doing what a lot of kids won't do, and that's the work. Now I want to get to Dr. Yolanda Whimberly. Dr. Whimberly, the format is I've had people introducing themselves because I don't want to slight anyone, and you're an amazing big deal, and I want you to tell everyone about yourself, please.
Thank you. Can you guys hear me?
Yes.
Okay. I am Yolanda Whimberly. I am the Senior Associate Dean for Graduate Medical Education and Clinical Affairs at Morehouse School of Medicine. I'm the lead physician for Morehouse School of Medicine at Grady Hospital in Atlanta, Georgia. I'm an adolescent medicine specialist, and I've been practicing adolescent medicine for the past 21 years. And I have been, for the past year and a half, one of the leads for COVID as it relates to Morehouse School of Medicine over in our on the front lines at Grady Hospital. So definitely excited to be with everyone tonight and excited to share any information and knowledge that's going to be helpful to ensure that especially our community, especially amongst young adults and adolescents, actually do get vaccinated. So glad to be here.
So thank you. And with that, Dr. Whimberly, I want to start our questions specifically with you, and we'll just pass it around.
Okay.
As a child and adolescent pediatrician at Morehouse and at Grady, have you seen many of the complications in the kids, in our youth? And if so, what are they?
Yeah. So fortunately for us here, we weren't seeing just a lot of complications here. Most of what our admissions were probably moderate to mild symptoms and disease processes. We had a couple of kids who had some severe complications, but as you all know, in the literature states for children, a lot of that is multi-system organs. So a lot of it was ruling out. So we would have kids come with fatigue, with rashes, with swelling. And what we were trying to do was rule out that it was something else. So fortunately, haven't seen a lot here, but probably about 10 to 15 cases that we've seen locally here. The biggest thing with us for kids is, as Dr. McGee mentioned a little bit earlier, is going back to school. For me, that is the biggest thing. We are really struggling. And I apologize for being a few minutes late, but I was actually in teen clinic. We're really struggling with getting people to get vaccinated. Of the 15 people I saw in clinic today, I asked all of them, did they want the vaccination? None of them were vaccinated, and none of them took me up on it, which was very concerning because of the fact that the reasons were not really anything that I could really work with, right? So it was, I just don't want to do it. You know, it was different than earlier in the pandemic where we could use education to be able to allow people to then come to the conclusion on their own that that was something they wanted to do. So that's kind of what worries me now is when we go back to school and we have all of these children and young adults coming together that have not been vaccinated. As you know, we know only 28% of those between 12 and 15 have been vaccinated, and what will happen at that time. But no, we hadn't seen. Fortunately, we hadn't seen a lot here in Atlanta of some of the major side effects that have been reported nationally at our local hospital system.
So thank you for that. Now, and I'm going to pass the questions around, but I want people to understand that Dr. McGee in his presentation brought up a fact: 99% of the people that are hospitalized or dying are unvaccinated, and 100% of those that have died are dead. I don't know how to put it any more plain than that. You know, that health literacy is one thing. So let's start from the bottom. They're dead. They ain't here no more. That's a wrap. You have when they talk about two Americas, you have the unvaccinated and you have the vaccinated. And it's our job as adults to model the behavior that we want for our kids. We can't have a better future for ourselves or for our kids if we don't show them the way. Now, some of the stuff that you would hear before, and again, I've been literally been on TV every day since March 13th talking about COVID. I've heard everything that you can hear. In the moment, they talk, oh, I don't want that myocarditis. Oh. And of course, you know, nobody has a pediatric cardiologist laying around in their back pocket to help refute it. By the way, yes, we do. Dr. Allen, as the interim medical director of the cardiac critical care unit, folks, that means it's for your heart and it's intensive, it's serious, care for your heart. And for those that aren't in the know, your heart is what's beating right now to keep you alive. Have you seen any severe complications of children with inflamed hearts in your unit with myocarditis? And then most specifically, after, and that's in general from COVID, but have you seen any of those with kids? And if so, how frequently?
Yeah. Well, I will say that I've actually interacted and been worried about, similar to Dr. Whimberly, more about COVID in my other role, where I'm the director of the neurodevelopmental program for kids with heart disease here. So most of my concern about COVID also relates to going back to school.
So you mean that's like having a big joker and a little joker in my hand? We got 2 in 1, folks. Just pay attention.
And that's good, right? It's good because we mostly haven't seen it. I mean, I am here in the cardiac intensive care unit every day. That's where children with myocarditis get admitted. There's something like, you know, between 1 and 10 in 100,000 people will get myocarditis. And when we say myocarditis, it's just like any other kind of inflammation. It just means inflammation of the myocardium, which is the heart muscle. So just like, you know, you can have inflammation of anything and it runs a huge spectrum. Sometimes that inflammation is mild and, you know, you have an ache or a pain in it, you take some ibuprofen and it goes away and you go about your business. And in some cases, it can be really severe and can even cause death. For the most part, while adults do definitely have COVID attack the heart, we have seen that much less in children. When at the height of COVID, when we sent our ventilator machines and our respiratory therapists and our heart-lung circuit life support machines, we sent them next door to the adult hospital because they mostly weren't affecting the kids. We did then learn about the MISC that we've been talking about, which is not so much COVID infecting the heart, it's the heart's immune response to COVID, which then gets out of control and causes inflammation of the heart. So we have seen some of that. I would say something around like maybe 25 cases of that here over the entire course of the 16 months. And about 1% of those cases will be fatal. We've been fortunate that we haven't had any fatal cases of MISC here. And then we have seen, we've started to see some cases of post-vaccine myocarditis, which is a thing people have talked about a lot. But again, there's a huge spectrum of what that means. So obviously what we don't want is for the vaccine to be a bigger problem than the disease itself. But we have had literally 7 cases, I pulled the numbers today, 7 cases of post-vaccine myocarditis. I can't tell you personally about any of them because none of them have been sick enough to require time in my unit, not any of them. Some of them got some ibuprofen and went home. Some of them got nothing and went home. And the longest that any of them have been hospitalized is 4 days. So when I think about the risk benefit of 4 days of ibuprofen and go home versus MISC, inflammation, and that 1% death risk, or even more importantly than that, what we do know is that there's been a lot of studies this year about how online school is nonsense and it doesn't teach anybody anything. And if we test the kids who are doing it, they will not have progressed. They have mental health issues. I would say what we've seen be an explosion here at Lurie Children's is not kids sick in the PICU or in the cardiac unit with COVID or post-COVID vaccine problems. We've seen kids admitted to the inpatient psych unit. We actually are in incident command, which means it's a hospital-wide emergency for how many kids are having unmanageable mental health issues. And so for me, when I think about like, we've got to weigh the risk benefit, right? There's no thing in medicine that's free. There's no thing in medicine that's perfect. When I weigh the risk benefit, there is no question that our kids have to be back in school. You want to talk about two different worlds where there's the vaccinated and the unvaccinated. Unfortunately for us, we are having a disproportionate representation of COVID infection and death and disproportionately low vaccine records, vaccination amongst Black and Brown individuals. So if you want there to be 2 different worlds, there's 334 million vaccinated people, of whom 70% are white people. So if we want our kids to get educated and be back in school and be part of society and be progressing and having the life they deserve, then they need vaccines, period. And the myocarditis, we just haven't seen it be enough of a problem for it to be of concern. It's not worth getting worked up about from what we've seen so far.
So thank you for that, Dr. Allen. My next question, Dr. McGee, we have a question from YouTube. And it says that I've heard we may have to receive booster shots, even after receiving both doses of the vaccines. Please share truth behind this rumor. Dr. McGee?
You know, the data is constantly changing. At first, we were told that 6 months, even 3 months after receiving your vaccine, you may need a booster. All the data now is saying that that's not a factor. You know, CDC and WHO are saying that right now we don't see anyone needing to get a booster shot at this moment. Now, keep in mind, though, as these things tend to culminate, and now you got more and more people together who are not vaccinated, then now you have more mutations going on. And so at some point, if we get down to the Zeta or the Z, and we've surpassed Delta and went through all the other different, name related letters, then we may need to get more vaccinations at that point and boosters. We may get to that point. So you never say never, but as of right now, it's not recommended that you have to get a booster shot at this point.
So we have other questions, but I want to talk about the elephant in the room because I know members of the community, I get the question a lot, and I'd like to know what each of you might think. So we want our kids to go back to school, and there are certain school districts are saying that vaccinated kids don't have to wear masks. There are households, I know of one specifically, several specifically, that have young kids where the adults are vaccinated and the kids are not. But they're asking all the kids to go back to school. The messaging can be confusing. A simple messaging with something to say that, ages pre-K to 5 have to wear masks for the kids because there's no vaccine yet. What do you recommend parents do? Because the closer it gets, we're in the middle of July and anxiety is going up. They're starting, we're having our back to school giveaways. But what do you tell those parents to do for those kids? And I'll start with Dr. Whimberly, and then we'll go around.
I think it definitely depends on the age of the kid. So if we're talking about 12 and up, which is where we have the vaccine authorized for the use, the message really has to be very simple. They need to be vaccinated. And that's really what I'm staying on, is that they need to be vaccinated. If you choose not to be vaccinated, they definitely need to wear a mask. So it's a simple message for me. Vaccinate, vaccinate, vaccinate. If you choose not to, then wear a mask at all times. For the kids who are unfortunately 11 and under, for which there is no authorization for the vaccine as of yet, the safest thing for them is really to wear a mask. And so that is what that's what I'm really messaging to my parents for kids of that age. It is difficult, as you guys know, the younger you are, it is difficult, for them to keep those masks on a consistent basis. But unfortunately, and hopefully we will get emergency use authorization for that age range soon. But until that happens, you need to wear a mask. Because this has unfortunately been politicized so much, mask wearing, as well as the COVID-19 vaccine, a lot of states, and I think Georgia, where I am, is one of the states that wearing the mask in the school system is not going to be consistent across the state. School districts can choose what they want to do, if they want to require the mask and who they require the mask for. In addition to that, you have a lot of private schools too who come into play as to whether or not they're going to require that. For me, that gets a little, it just gets a little messy. And I think we need to make sure that we just pull back and do a simple message. If you're vaccinated, if you're vaccinated, in most instances, mask wearing in the school system is where they're saying that that's optional. If you're not vaccinating, wearing that mask is. Now, having said that, you get into the caveat of I experience this now when people walk around, they don't have a mask on, you're wondering, are you vaccinated or not, right? And when you're talking about teenagers and young adults, that just becomes, very kind of nebulous. So there's an assumption that if you don't have a mask on, that you're vaccinated. And so how do you verify that that person has been vaccinated, which is going to get tricky. So it is not a good place for the school systems now. And because of that, what I would state, if I were in charge of the school systems, is to say everybody, unfortunately, has to wear a mask. It's unfortunate, but everybody is going to have to, until we get those numbers up higher than 28% for that age range, everybody is going to probably have to wear a mask. My children are vaccinated. They were in a trial, so they've been vaccinated now. I have 14-year-old twins. They've been vaccinated now for a while. They will wear a mask when they go to school, just because of the fact that I feel strongly that we have to protect those who, unfortunately, for whatever reason, have not chosen to vaccinate themselves. And so until we get those rates up, it's going to be very important. And so that's what I would message. We don't necessarily like it, but I think until we get those numbers up, to be a responsible member of the community, that's something that's going to be warranted.
So I absolutely agree, particularly with this Delta variant out here. Dr. McGee, you want to elaborate on that? How much more infectious this is, and how it affects adults and kids? It can affect adults and kids.
Well, I mean, they're saying that the Alpha variant was about 30 to 50 times more virulent.
That's the one from Britain, y'all. They done switched up on us. It would be 1, 3, 5, all at 1, 4, 5, 6, 7, 10. Britain now it's Alpha. The original type, the wild type, the original one ain't even Alpha. We starting with the Britain. But go ahead. I'm sorry.
But that was more deadly.
The way everybody else does.
They said that was more deadly than the original coronavirus. And then now this Delta, which is from India, is 50 to 60% more times virulent than the Alpha. So it's a deadly disease. So we can't. I know everybody is tired of hearing about this stuff, and we want it to be over, but it's not. It's not over, and we just got to be cognizant of that and do what we need to do. Like everyone has said, you got to get the vaccine. No ifs, ands, or buts.
Thank you, Dr. Allen. I'd like for you to weigh in. Again, what do, as a parent, if I have my kids and they are under the age of 12, what can I do when they go back to school? And what do you recommend is my best practice to do at home, in public and in schools?
Well, in addition to, the other thing that I do is that my mom owns a gymnastics school in the suburbs. So, and I spend all of my free time, which is not very much, helping her with that. So we have a lot of kids who are under the age of 12 there, and they can't get a vaccine. And they're not just under the age of 12, they are flipping around and exercising, and they wear masks in that gym every day. And we told the parents that they have to wear masks. We're not going to let the 7-year-old kids come in here and flip around, and you're not going to wear a mask just because you have a vaccine. We need to lead by example. Yeah. So everyone in that facility wears a mask all the time. Similarly, in the hospital, I have kids who are 2, 3, 4 years old who have not related to COVID, fortunately, but they have bad heart disease, and they are on oxygen, and they are on special drips to keep their heart going. And when they walk around in the hallways of this hospital, they wear a mask and they do not complain about it. So if we would lead a little harder on the mask issue, it wouldn't be as big a deal for our youth. And I think that is the message for kids under 12, that the best way to make it so that they can stay in school and have the experiences that they need to have to be successful adults in the long term is to keep the school open. I'm not that worried that 7-year-old is going to get really sick and end up in the ICU from COVID. But when they get COVID, because they can't get a vaccine, it's going to shut down that classroom. They're all going to end up at home again. We're going to end up back on virtual school for a month. That's a wasted month of not learning, of stress, of parents trying to figure out, how am I supposed to work? How am I supposed to whatever? We don't have room for that anymore. So people need to get vaccinated who can get vaccinated. And as soon as the vaccine is available to under 12, people should get that too. But in the meantime, I would suggest that anyone who doesn't have a medical reason not to wear a mask, It's not that big a deal. Just wear it. And then maybe we could all live a little for a little bit. You know, poor Donovan just wants to live a little. Let him have it. We could help him if we would lead a little bit better.
So I know we're running short, but I'm going to ask this rapid fire. Dr. Allen, can you give me one medical reason, just one, and I'll go around, one reason why you can't wear a mask?
No. Claustrophobia.
Okay. Dr. McGee, can you give me a reason why you can't wear a mask?
Because I'm a Republican.
Got it. Dr. Whimberly, what about my CO2? And you know what I'm saying, with my asthma? Why can't can you give me a reason why I need a reason why I can't wear a mask?
The only reason I would think is that people who have oral facial deformities. And so, we have seen that, but that's not very common.
Now, we know we need to be specific because everybody, my nose is a little big and I smile crooked. And
no, where your airway would be compromised. So, there are folks who have problems with their nasal passageways and things of that nature that a mask would obstruct it, but that's going to be very few and far between.
So, folks, here you have it. Amongst the four of us, there's almost 100 years of experience in the community, in medicine. We don't want to count the number of hours, minutes, seconds that we've all put into this. Like I said, back when we all started med school, Dr. McGee and I had hair. But the true experts from a youth perspective, we have one online. Donovan, I'm gonna give it to you. Before I close, I want to get your final thoughts on this about COVID, the vaccine, school, masking. Give it to us, Mr. Brown, University entrepreneur.
Well, I just think that everyone should get vaccinated. As simple as that. I think that it'll help us return to life as normal. I personally know people who are not that much older than me who have contracted COVID-19. Unfortunately, they're my family members and my cousins, and they were unvaccinated. And I was with them, and I am vaccinated. My mother and my brother, who were also with them, were vaccinated, and we didn't get it. And now we feel safe, and we're praying for them. But and we're praying for anyone else who gets it. But we just gotta, we just gotta get vaccinated. Schools should either mandate or should either, have kids get vaccinated or should have them wear masks. It's as simple as that. It's beneficial. All of you are well respected in your fields. Your doctors, you couldn't come up with reasons that would apply to as many people as don't want to wear masks as a good reason for them to not wear a mask. So I think that people just need to get vaccinated. You need to trust the science. Research has gone into it. The government is not trying to control us. It's good for you. So you got to wear a mask and get vaccinated.
So, Donovan, with all due respect, because you are definitely a brilliant and bright young man, and following your lead, our future is very bright. But I want to say this, folks, it's out of the mouths of babes that we hear the truth. That's the reason that I do the animation, because people listen to the kids and watch what kids are learning. You heard it here first. I want to thank all of you for tuning in. It's been my pleasure to be the moderator. We have a minute and a half left, but I want a final word from each of our other esteemed panelists. Dr. Allen.
It just
don't get frustrated. I know.
Don't listen to the nonsense. The rest of it is nonsense. It's nonsense. No. Get the vaccine. It was a good experience. Trust me. Nonsense, the rest of it.
Dr. Whimberly.
I would just repeat that as well. Just, get vaccinated and just go for it.
Dr. McGee, we have one question. Our children want to go outside, be social. How should we govern our movements at this point? Handle that for me, bro.
I think it's already been answered. If you're outside, at this point, if it's your own family, you're around only themselves, it's okay to be out there, probably without a mask, if they're isolated. But if they're going to be around other kids and other family members, or you don't know what their status is, you should want to do what's best and err on the side of being conservative and have them wear their mask. And one final thought, as an ER doc, for the past year and a half, I've been dealing with people dying on a regular basis. They come into me, and then the next day I know that they died. They've died in front of me And this is happening all across the country. All of my ER colleagues from the American College of Emergency Physicians see this on a daily basis. I don't have time to be out here doing talks like this, but it's important to me as a Black man who cares about Black people that we all do what we need to do to sustain lives and others. I've had mentees who have gotten, who are depressed now because their grandparents died from their cousin who came home from school with COVID and went to the grandmother's house. And the grandmother and granddad both died. And we all have lost a lot of people through this time. I've had several family members die from COVID. This ain't no joke, yo. We got to do what we got to do what we got to do. And it's happening to Black people at a proportionate level. So let's be sensible. Let's have, use common sense and get the vaccine or wear your mask or do what you need to do to not get infected or infect others who you care about. I don't want to see you crying when that person doesn't do well. So thank you guys so much for this. Appreciate you guys.
And Dr. McGee, if people should have further questions, how can they reach out and to us to get their answers?
Well, they can. This is going to be posted on 100 Black Men of America's website so that you guys can still go out and see it. We also going to be circulating these wonderful animations by Dr. Griggs. And also look out for July 24th. If you're in Chicago, come on down and get your vaccination. If you're a parent and you have kids, we also doing immunizations. So you have to have mandatory immunizations for your kids to get back in school. So we're doing those as well with the Chicago Department of Health. So we're doing all of that, and we're going to be broadcasting it. And then now we're going to also send it out in a video so that people can see that, hey, it's not as bad as you think. So it's going to take time, but we have a little bit of time before school starts back at the end of August. But we want all of you guys to do your part and try to convince people who don't want to get the vaccine that it's worth doing. Thank you.
And with that, Facebook at 100 Black Men of America. You can follow us on YouTube at 100 Black Men of America. You can follow us on Instagram and Twitter at 100 Black Men. And you can go to our, make sure I read it right, that is 100 Black Men. And you can go to our website, 100blackmen.org. It's truly been my pleasure to be your moderator this evening. This will be recorded. Again, I want to thank all of our esteemed panelists. Donovan, if you need anything from us, let us know because we'll be following your lead at some point. Thank you again, and we humbly appreciate you tuning in. We appreciate it. Thank you, folks, and have a great evening.
Thank you, guys.